Patient Data Privacy and Security, HIPAA, GDPR. The protection of patient data has become a paramount concern for healthcare organizations worldwide. The Health Insurance Portability and Accountability Act, HIPAA, in the United States and the General Data Protection Regulation, GDPR, in the European Union are two significant legislations that aim to safeguard patient data privacy and security. While both regulations share similar goals, they differ in scope, requirements, and enforcement mechanisms. HIPAA was enacted by the U.S. Congress in 1996 to ensure the privacy and security of individually identifiable health information. It applies to covered entities such as healthcare providers, health plans, and healthcare clearinghouses. Under HIPAA, these entities must implement administrative, physical, and technical safeguards to protect patient data from unauthorized access or disclosure. One of HIPAA's key provisions is the privacy rule, which grants patients control over their health information by limiting its use and disclosure without authorization. Covered entities must obtain written consent from patients before using or disclosing their protected health information, PHI, except for treatment purposes or when required by law. Additionally, covered entities must provide patients with notice of their privacy practices. The security rule is another crucial component of HIPAA that requires covered entities to implement measures to protect electronic PHI, ePHI. This includes implementing access controls, encrypting ePHI during transmission or storage, conducting regular risk assessments, and training employees on security awareness. On the other side of the Atlantic Ocean lies GDPR, a comprehensive data protection regulation that came into effect in 2018 across all EU member states. Unlike HIPAA's focus on healthcare organizations only, GDPR applies to any organization processing the personal data of EU residents, including those outside Europe, making it one of the most far-reaching regulations globally. GDPR introduces several new concepts compared to HIPAA. It emphasizes transparency by requiring organizations to provide individuals with clear and concise information about processing their data. It also grants individuals expanded rights, such as accessing, rectifying, and erasing their data. Furthermore, GDPR introduces the concept of data protection by design and default, which means that organizations must incorporate privacy and security measures into their systems from the outset. This includes conducting data protection impact assessments, DPIAs, to identify and mitigate risks associated with processing personal data. While HIPAA and GDPR aim to protect patient data privacy and security, they differ in enforcement mechanisms. HIPAA is enforced by the U.S. Department of Health and Human Services Office for Civil Rights, OCR, which conducts audits and investigations and imposes penalties for noncompliance. In contrast, GDPR is enforced by supervisory authorities in each EU member state, who can issue fines up to 4% of an organization's global annual turnover. Mechanisms. Healthcare organizations must ensure compliance with these regulations to maintain trust with patients while safeguarding their sensitive information effectively.